Thank you very much, Dr. Weirden. Dr. Slaughter, ladies and gentlemen, good morning. It's a real honor and a privilege to be invited to make this presentation today. I have to confess that when I was originally asked to make this presentation, it was intended to have a title, ASAIO's History of 60 Years of Innovation. But after I spent about a week doing the research, I realized that I could never do that topic justice. So I alternatively changed the name to A Tribute to ASAIO, to its members past and present. And what I'd like to do in this presentation is to begin by, first of all, describing what I know about ASAIO over its first 20 years. And then, fortunately, I've been a member for about 40 years. So what I'd like to do is share my personal experience in terms of the conference, the journal, the people I've met, and the events that I've witnessed over the last 40 years. But I know some of you are history buffs, so what I'd like to do is direct your attention to Project Bionics on the website of ASAIO, or to speak to either Gene Kantowitz, Mark Caruso, Bob Bartlett, Steve Phillips, or Gus Rosenberg, who are the true historians of ASAIO. So let me begin with the beginning. The date was June 5th, 1955. The president was Dwight D. Eisenhower. The car that everybody wanted to drive, at least in my hometown of 5,000 people, was the Chevy Impala. The Dodgers had won the World Series, and we all used to sit around watching black and white television with the likes of Ed Sullivan introducing the king of rock and roll, Elvis Presley. It was a time when rudimentary dialysis was first being used clinically, when the first heart-lung machine was developed and used by Dr. John Gibbons. And all of these people I'll be mentioning were either members or participants in previous ASAIO meetings. The first bubble oxygenator had been introduced by DeWall and Lillehei. And the year before, the first kidney transplant had been performed at the Peter Bent Brigham Hospital in Boston with Dr. Joseph Murray and Dr. John Merrill. And Dr. Murray went on to get the Nobel Prize of Medicine. And you can see this historic event in this slide. It was in 1954 that a German-born physician, Peter Salisbury, who had a primary interest in artificial kidneys, decided to send a letter to many of his soulmates discussing the possibility of forming a society of artificial internal organs. The setting for the first meeting was at the Chelsea Hotel in Atlantic City, New Jersey. You have to recall this is when Disneyland was first opening up, McDonald's had just started, and for a young kid sitting around watching commercials on black and white television, we learned that Winston's tasted good and Hamm's was very refreshing, not to suggest that that would leave such a lasting impression on a young boy's mind. The first program had 67 participants. There were 29 presentations focusing on the artificial kidney, the heart-lung machine, red cell centrifuge, and artificial placenta. They discussed during those first couple of meetings exactly how to name the society. They knew they wanted it to be American Society, and more would be artificial internal organs. But there were one or two members that thought that artificial internal organs was too kaleidoscopic, perhaps even pornographic. But at the end of the meetings, when they couldn't agree on a name, they all decided they'd simply call it the Society for Open Hearts and Shut Down Kidneys. 20 years later, in the first review of the history of ASAIO, George Schreiner, one of the first editors, called ASAIO the history in the making. It was seen as a light around the scientific and medical world. And he likened the launch of ASAIO to the launch of the Apollo mission in 1972. And they all marveled that the presentation of heart surgery in those meetings was in color, which was considered revolutionary at that time. We have to have a good understanding of who our founding fathers were. Our second co-founder was Dr. Willem Kolff, often called Pip. He was regarded as the father of artificial organs, a pioneer in artificial kidney and heart development. He served as our first ASAIO president and as viewed as one of the greatest scientists and physicians of the 20th century. And for all that, he was nominated for a Nobel Prize in Medicine in 2003. Shown here is a picture of his roller barrel dialysis machine, and we can see it used clinically in the bottom left figure. And this is circa 1974 when Dr. Kolff was visiting a patient in one of the hemodialysis clinics. Our third co-founder was an American-born cardiothoracic surgeon named Clarence Dennis. He was inspired by John Gibbon to further develop the cardiopulmonary bypass machine, and he had his first successful surgery with this cardiopulmonary bypass machine in 1955. He served as our second ASAIO president in 1956 to 1957 and went on to direct the artificial heart program at the National Institutes of Health from 1972 to 1974. We also have the likes of Walter Lillehei, often described as the father of open heart surgery. We have the surgeon and physiologist George Close, and we also have the infamous Adrian Kanchowitz, who is a cardiothoracic surgeon, an inventor, and an entrepreneur, and I'll have much more to say about Dr. Kanchowitz later. We have our pioneers in dialysis, including Dr. Christopher Blagg. He's been involved with dialysis since 1958. He's published more than 300 papers and book chapters on dialysis. And his major contributions have been to home dialysis and to have longer and more frequent hemodialysis. He's considered a scholar in the history of dialysis, and all of this work has been aimed at improving the lives of people on dialysis, for which he's received several Lifetime Achievement Awards. We have Dr. Benjamin Burton, who developed the artificial kidney and chronic uremia program at the National Institutes of Health in the late 1960s and went on to head that branch of the NIH for 34 years. And then there's Paul Teschen, who is a professor of medicine at Vanderbilt and a medical director of dialysis clinics in Nashville, Tennessee. When we started looking at our cardiac heroes, we have Dr. Charles Hufnagel. He created the first artificial ball and cage aortic valve. We can see the valve placed in a descending thoracic aorta in the right-hand figure. He did his first implant in 1952. However, he was at all the early ASAIO conferences. We now see an engineer link up with a clinician. Wilson Greatbatch, the engineer, teamed up with William Sharrock to develop the first pacemaker, and this occurred in 1958. And I took a quote of that experience where they said, they attached the device to the heart of a dog, touched the two wires together, and then stared in awe as the little device took over control of the heartbeat. And you can imagine what exciting day that was. We have not only the conferences where we exchange information, but we have our journal where we disseminate that information to the rest of the world. And the first author who authored the Transactions of ASAIO in 1955 was Dr. George Schreiner, who remained the editor for so many years. In 1978, Pierre Gleddy took over and formed the ASAIO Journal. And then more recently, in 1992, Dr. Eli Friedman took over as editor and combined the Transactions with the ASAIO Journal. And he's best known for developing the suitcase kidney, which really changed the whole field of dialysis. And the more recent editors of Jay Swissenberger and Mark Slaughter have also done a fantastic job. So that was the first 5 years of ASAIO. Now we go to the 1960s, which is also a glorious decade. It was a time when John F. Kennedy was president, and then he was not. I think for anyone that was alive at that time, we remember exactly where we were and what was happening when the president was assassinated. And we are all in shock when we watch Lyndon Baines Johnson coming back, taking the oath of the presidency on Air Force One returning from Dallas. And that was also a time when we saw the invasion of the British, the Beatles. It was in 1960 that Belding Scribner teamed up with an engineer, Wayne Quinton, and developed the Scribner shunt. It was a device that allowed patients for the first time to be connected repeatedly to hemodialysis machines, thereby launching the era of modern renal replacement as we know it today. Then we see Henri Tenkhoff, a German-born physician who was born in Cologne, Germany, practiced in the UK as well as Australia, ends up teaming up with Dr. Scribner in Seattle, in the mecca of dialysis, and goes on to invent the Tenkhoff catheter for opening up the field of peritoneal dialysis, and that was in 1965. Other pioneers in peritoneal dialysis include Dr. Paul Doolin, currently alive and living in Maine, and Marty Roberts from UCLA and the VA system, developing the automated wearable artificial kidney. And then a really miraculous event occurs in 1967. We see in the central picture that we see Dr. Adrian Kanchowitz along with Dr. DeBakey along with Christian Barnard. And it was in 1967 that Christian Barnard performed the first human heart transplant in South Africa. And then 3 days later, in that same month of December, Dr. Adrian Kanchowitz performs the first heart transplant in the United States. And to the right we see Jean Kanchowitz, Adrian's wife, always at his side, one of my favorite people in the world. Jean has gone on to be her own entrepreneur in advancing the field of left ventricular assistance as well as percutaneous access. Still in the 1960s, Dr. Adrian Kantzwitz begins to introduce the intra-aortic balloon pump, also unveils his pacemaker research, and continues his pursuit for a percutaneous access technology. It was also then that Drs. Kantzwitz and DeBakey independently performed the first VAD implantations. Later in that decade, in 1969, Dr. Denton Cooley had been working with Dr. DeBakey, and Dr. Cooley then went across the street working with Domingo Leota and actually implanted Leota's total heart for the first time in a human patient with excellent results. Meanwhile, in Asia, we have our counterparts. We have Professor Akutsu and Itsami carrying out their own artificial heart research and coming to the ASAIO meetings, exchanging what they are learning from what we have at ASAIO at that time. We're now in the 1970s when Nixon was president, when Cassius Clay became Muhammad Ali. We see the Kent State shootings, the oil embargo was in place, and yes, the Vietnam War was raging. It was in the 1970s that Dr. Frank Hastings at the NIH, along with Dr. John Watson, really aggressively pursued the artificial heart program. And we all recall Dr. Hastings' goal, which was to speed the day when safe and effective devices could reach the bedside and result in major reductions in death and disability due to heart disease. And I think no matter what organ we work on, we all share this mission. In the 1970s, cardiopulmonary bypass transitions to routine clinical practice. We see the first use of ECMO in San Francisco in 1972. We see Dr. Bartlett performing the first neonate ECMO in 1975 and the first publication of ASAIO Journal in 1978. In this slide, we see in the upper right-hand corner Dr. Donald Hill, who did that first ECMO implant in 1972. He also went on to be the founder of Thoratec. And Dr. Bob Bartlett on the left at the University of Michigan has dedicated his entire life to ECMO. He's established the ELSO registry and really promoted the formation of the Red Book, which is the Bible for ECMO, which we all rely on. Also in the 1970s is Dr. Leonard Golding at the Cleveland Clinic, taking centrifugal pumps, using them either unilaterally or bilaterally to show us that they're quite satisfactory in terms of bridging a patient to transplant. And it's Leonard Golding who changes our thinking of these devices as being non-pulsatile to continuous flow devices, which is how we think of them today. We're up to 1980s, and Carter is president, and Reagan is president. Michael Jackson's on the scene. We have the hostage situation, but I have to admit, one memory I have that I'm very fond of is when the U.S. amateur hockey team, mostly out of Boston University, went on to beat the powerful Soviet Union to win the Olympic gold medal. It was in the 1980s that hemodialysis became routine use, and we see the implantation of a total artificial heart, where 50% of cardiopulmonary bypass procedures performed with membrane oxygenators was happening versus the bubble oxygenators. We also see great progress with the artificial liver. It was in 1980 that Dr. William Pierce at Penn State Hershey teamed up with Dr. Gus Rosenberg and Mr. Donachie to make the Pierce-Donachie left ventricular assist device, which has gone on to save so many lives. It was in 1982 when I was at a contractors meeting with Dr. Watson presiding, with so many of us working on animal studies to develop ventricular assist devices where we felt they wouldn't be in the clinic for years, that we witnessed that the first total artificial heart, the Jarvik 7, had been implanted by Dr. DeVries. And once again, we see Dr. Kolf. And the press went crazy. We see in Life magazine, the artificial heart is here, and we see articles about medical miracles. It was Don Olson that was heading up the University of Utah Artificial Heart Lab, and we see the young Rob Jarvik as he's holding the Jarvik 7. And we see Dr. DeVries with Dr. Barney Clark, who was supported for 112 days with his first total artificial heart. It wasn't a perfect experience, but we learned so much, and we were all in awe. Also, Dr. Lyle Joyce, Dr. Wayne Rickenbacker, and Nelson Burton were participating in that landmark experience. And you see the Newsweek article that talks about man makes a heart. It's the bold new world of cardiac medicine, and that's just how we all felt. It was in the 1980s we see advances in the artificial liver using porcine hepatocytes with Dr. Demetrio. And we see major advances in the artificial lung and respiratory assist technology with Dr. Bartlett once again at the University of Michigan. And we see Jay Swishenberger, who had studied under Dr. Bartlett, become an emerging leader in artificial lung technology, along with Dr. Bartley Griffith and Bill Federspiel from the University of Pittsburgh. We continue to see advances in renal dialysis, looking at Jim Winchester and George Schreiner and Joseph Murray. But we see Stephen Ash emerge on the scene, a nephrologist, someone that's now develops his own business as an entrepreneur and a real pioneer in dialysis. And then we have Ed Leonard, an engineer at Columbia University, who is pursuing and succeeding in developing hemofiltration technology. Other renal champions included Rob Lindsay, Tom Deppner, and Adrian Kaplan from the University of Connecticut. And in the 1990s, Clinton's president, Mandela is free, finally, and we see Google on the scene. And now we see the first generation of BADs win FDA approvals. These were pulsatile flow devices driven either pneumatically or electrically, basically positive displacement pumps. And in 1992, I remember when David Letterman from Abiomed got the first PMA approval with the BBS 5000. And I called up David and I said, I have three things to say to you. First of all, I'm very envious because we're still years away. You did it first. Two, absolute joy. You've shown us it can be done. And number three, congratulations. And he was quite gracious about it. Of course, he had to call us the next year. So David called me and congratulated us because we had succeeded in getting a PMA approval on the first implantable left ventricular assist device in 1993 with a pneumatically driven implantable ventricular assist device. The founder of the company was Vic Poirier. I co-founded the company with Vic. And we are eternally grateful to Dr. Bud Frazier for his clinical guidance and leadership, leading all 25 centers to get that approval and remain grateful to this day. In 1994, we see Novacor finally gets their FDA approval for the Novacor LVAS. And shown here is Dr. Pierre Portner, the founder of Novacor, with Dr. Phil Oyer from Stanford. And at the same day, the HeartMate VE also got approved for thermal cardio systems. And then finally, Thoratex PVAD wins FDA approval in 1995. And we start seeing pictures of patients that are New York Class 4, bedridden, in severe congestive failure, getting up. And we see them exercising and see them leading near normal lives while they're being supported as a bridge to transplant. And it was inspiring to all of us and gave us the reason to believe that these devices were beyond the market and helped many patients. We have the landmark rematch trial where a randomized controlled study was carried out to compare BADs against optimal medical therapy. And we see that there was a statistically significant improvement in survival for patients on BADs compared to optimal medical therapy, which is a key trial. We see Dr. Eric Rose, who led the rematch trial, along with his colleagues, Dr. Bud Frazier, Lynn Stevenson, Jim Young, Jim Long, Bill Holman, Cy Tector, and so many others that made this trial a success. And then we start seeing the second generation of ventricular assist devices. And we're looking at Dr. Richard Wampler, who I think we'll all agree is the father of the rotary blood pump revolution. He comes to us and he talks to us about how he developed the pump around the Archimedes screw. And he works with his engineering partner, Ken Butler, to develop the hemopump. And I have to admit, I was in the audience, and along with many of my colleagues, when I looked at this and I saw a small tube with an impeller rotating at 27,000 RPM, and we actually thought Dr. Wampler was nuts. But he proved us all wrong and opened up a whole field for our next generation of technology. So the second generation VADs were smaller, they're simpler, they have diminished pulsatility, they're continuous flow pumps, and they're generally either axial or centrifugal configuration. We see the Micromed DeBakey pump released. We also saw the HeartMate 2 device released. We're also seeing significant progress being made by Dr. Yuki Noze on the artificial liver. And in fact, he was instrumental not only in the liver, but the LVAD technology, total heart technology, and wrote some of the best editorial articles I've ever read. The decade of 2000 has been bittersweet with 9/11 and all the other events that have occurred. But now we see Abiomed introducing the AviaCore total artificial heart, and we see the flagship University of Louisville taking the lead with Dr. Lehman Gray and Rob Dowling and Mark Slaughter leading the way, proving to us that total artificial hearts can work. And we also see Syncardia with their total artificial heart. And we see what is called the Big Blue driver being scaled down to a very portable, Freedom portable driver, not only showing and making it much more feasible for a total heart to be used in a patient, but actually setting the stage for the creation of a very valuable and viable new company, led very much by Marv Zepnian, who will be the next speaker. We now see the third generation ventricular assist device that are bearingless. We see pumps like the Ventricor Assist, which has a hydrodynamic bearing, and we also see fully magnetically levitated systems such as a Heartware device. It was then that I helped form Levitronics and created the Centromag device. It's an extracorporeal temporary system to support patients for up to 30 days in a bearingless configuration. And we see a patient being supported on biventricular assist on the right side of the photo of the slide. And I believe there's somewhere around 4,000 of these devices supporting patients a year to date. We then see the emergence of World Heart with Levicor, with Jim Long's involvement and the whole NovoCore group involvement. And then we hit the mainstream as we see that the Vice President of the United States, Dick Cheney, was implanted with the HeartMate 2 device and successfully supported for 20 months when he got successfully transplanted. But now the whole world knows about ventricular assist technology. And the next thing in 2000 was we see that LVAD destination therapy becomes a reality. Patients are leading their normal lives as an alternative to transplant. We see Dr. Frazier continuing to push the envelope as he is promoting the development of a continuous flow total artificial heart along with Dr. Billy Cohen. And throughout all this, we've worked closely with FDA, we've worked closely with Art Siakowski and Bram Zuckerman, but always at these meetings we see Eric Chen and Sona Patel always working closely with the investigators to try to advance the technology and get those approvals. So now businesses really start to take the lead. We see Thoratec with David Farrar, who's been a pioneer since the beginning and one of the first employees of Thoratec. We see Heartware with Doug Godshall and his team. We see Terumo emerging with Dr. Nojiri from Japan, developing the DuraHeart, the Jarvik heart, evolving to also introduce us to the Jarvik child and infant hearts. Micromed is making advances. And then we see many more companies such as Circulate, Sunshine Heart, Eva Heart, and even the Aero Lion Heart. So out of ASAIO evolves a whole industry. And not only in the cardiac side, but we see industries coming out of the renal side. And it's really impressive to see today that there are 374,000 chronic dialysis patients in the United States based on that early work at ASAIO. We move from adults now to pediatrics, where the mortality rate for a pediatric patient waiting for a heart transplant is 25%, and neonates comprise the majority of patients on the waiting list. We see companies such as Berlin Heart getting the first FDA approval for pediatric support under the leadership of Bob Krosolwitz. And then we see Tim Baldwin at the NIH making his legacy as he develops a pediatric program called Pumpkin. And you can see work being done between the University of Maryland and Levitronics, NCN, University of Pittsburgh, and the Jarvik technology. So out of one society comes many societies. And it's incredible when you look at the list of contributions that ASAIO has made to society. The list is extremely comprehensive and touches upon just about every medical device that's used clinically today. So who is ASAIO? You are ASAIO. You're an engineer, you're a scientist, you're a clinician, and your industry. But what's really unique about ASAIO is that we all work together as equals. But the real future of ASAIO is going to depend upon our young investigators. And we have Tim Kaufman, who's the president of our Young Investigator Group, along with Salima Olia, who's the vice president. And we can only imagine what technology and breakthroughs they're going to develop in the future as we pass the baton to these young investigators. So I just want to say a special thanks to Dr. Bud Frazier, Igor Gregoric, and the late Brano Radovankovic for all the support that they've given us over the years in advancing ventricular assist technology, and to the biomedical engineering and pediatric cardiothoracic surgery groups at the University of Pittsburgh, and specifically to Dr. Pete Weirden, Dr. Harvey Borovitz, Bill Wagner, and Marina Karavina, and to Dr. Bartlett and John Wu at the University of Maryland for all of the work helping us to advance the artificial lung technology. And we all need to say a special thanks to Karen Burke, who's the backbone of ASAIO and has been the executive director for so many decades, and has really made all of these conferences just such a great success. And to all the former presidents and board members who have worked tirelessly over the years to make ASAIO a success. But most importantly, I'd just like to say congratulations to ASAIO and its members for 60 remarkable years of amazing innovation.